you really are. You know, once I should have kept the camera on before because you're just the sweetest guy with the camera on.
Yeah.
This is a true dilated pore of Weiner. Okay.
I think that's deep already.
What was it?
It's deep already because they.
Yeah, it's harder to.
Tried to remove before, but it went
Really?
back.
You just have to. Yeah. Oh, it came back. It did come back? Okay,
Yeah.
well that is the thing because it is a pore, it's dilated already, so that's why it's so hard to, it comes back because there's an opening there. So since there's an opening there like that, it does make it difficult that it can come back. See, it's like it's like a little hole, like a little pothole. You okay? Okay. Sure, right?
Yeah.
Okay. Because it's like a little pothole that just fills up. Like I joke with my patients, you could smuggle diamonds or something if you wanted to. But what I would say is if you want to make sure that this is not going to come back, you do have to come back again because you could put a little excision in it and remove the little pothole.
Okay.
You shouldn't though. Wow, you really left this thing alone, huh? Didn't touch it at all. Pretty hands off of it. I'm going to use my new little trusty device here and push on it here, okay?
Okay. You feeling anything, Dad?
That's pressure, right?
No
Pushing
pain?
against you.
No.
Good. Yeah, she's just getting enough.
You like to watch this stuff too, Mary? Kind of?
Yeah, just mainly watching Dad.
Oh, that's okay.
Yeah, that's
but it doesn't gross you out at least, you know.
Oh, no.
Okay.
You was there for the appendicitis too.
Oh, yeah.
Oh, he had appendicitis?
Yeah.
Oh, that's no fun. That's scary, actually.
He sent me home the same day.
Oh,
Really?
he did? You must be a tough guy. Am I hurting you?
No.
Okay, I'm just pushing against you, okay? Because I'm going to push out this. I do believe this is a cyst and not something to worry about, but we'll check it, okay?
Yeah. And just say Dad if it hurts because they can always numb it.
Oh,
more.
yes, absolutely. A lot of times when we numb, yeah, careful, there's a little pedal under there. A lot of times when we numb, we can't get underneath it very well. So I always try to, I have extra here in case I need it. But I'm just trying to ease out as much of it as I can.
Okay.
All right,
You still tugging, huh? You don't feel pain though, right?
No.
No,
Good.
that should be fine. Everybody's okay, right? Everybody's good? Okay. I just try to pull. See, we got to get the whole sac wall out, so I got to tease around it. Actually, I think I'm going to give him a little one numbing. I might have to just do without it. That one's a little too small for me to use. So this is really superficial.
Oh, good. So it's not real deep.
Oh, yeah, no, it's not. But I need to get under it and take all that off here.
You feel anything, Dad?
Huh?
No? Good.
Good.
And
Yeah,
it's
good.
not bleeding
Good.
bad at all.
No.
No, not bad at all. Just, it's very thin to the surface. That's why I actually was open at the top there, because it was actually like almost like a big blackhead, really. Like called a dilated pore of Weiner.
I can tell you, there's body lotion on my
Right.
legs.
That's okay. I'm gonna put a little numbing here, so don't move around too much here, because I don't want to have it hurt you and make you jump like I just did on your leg. I'm just gonna numb around it so that you can't feel me kind of squeeze it out hard here. Because you said it keeps filling up, but it's been a long time since it's been squeezed out, so maybe it won't fill up this time. Let's take a look at it.
It wasn't deep, she said.
Twice.
Twice, and it's the biggest it's ever been, huh? It's under there.
The second time I had it removed,
It's bigger and wider than it looks.
it was,
What do you say? That?
it wasn't the doctor, it was the PA, is that what you called him?
Yeah, physician assistant maybe?
Yeah, and said, oh, the core was not removed, that's why it grew back. So I didn't.
Did you already get it?
No, I didn't. I didn't want to. We're interrupting you. I'm sorry. We're all like ignoring you.
That's okay.
I can't listen to
It's
her.
like a little plug in a faucet. Remember old school plugs, like those black plugs that you have in a faucet? Oh, look at that. You want to see it?
No.
Not you.
Don't show it to her. Don't show it to her.
Really? Why?
Do you want to see it, Mom?
No.
No.
I told you.
Yeah. That's pretty wide. Come to the this side, come all the way over and see. Yeah. If I close that up, I think it's just gonna refill because it's the sides aren't refreshed. Like if you don't have cut edges, it won't stick together. You know what I mean? So it's like it's just like your own little coin purse. You got a big black blob removed on and now you have a big blackhead removed here. Your wife is not taking a look at this? She didn't want to take a piece of this?
I don't even.
She not even really looked at it, huh?
I didn't even look at it.
Oh, you felt it, right?
That's why I'm here. No, I didn't feel
Oh, you
it.
didn't even know it was here? Oh, it's even too big for my... I think it's even too big for my comedone extract. I can barely fit around it. Yeah, you have this thing that you've been storing here. In fact, there's still a little bit more. Come from this angle here. This side you can see. Ooh, drop part of it. Here. Okay, right?
Yeah.
Push against your ear here to just pop it out. Just grab a little bit more of it. Gosh, no wonder it's hard to get to this place to squeeze it. It's like the little corner, nook and cranny of your world.
Mm-hmm.
Again, just make sure I'm not hurting you. He likes you. Doesn't want to leave that easily. We got him. Almost have the whole thing. Sometimes you can just tug on it and it comes out, but yours is stuck to you a little bit.
It's attached.
Yeah, just stuck a little bit, but I almost have it all. Almost got it all. Just happy to see me?
No, your beauty was
Oh,
beckoning to me.
I was good. Oh, you really are. You know, I should have kept the camera on before because you're just the sweetest guy with the camera on.
Yeah.
You're pretty sharp like that. I was telling him that he has the record in my 12 years of working. He may be in the top 10 for one of the most ornery.
And
I think he's in the number 1 for the one who's cursed more than. And it's numb now, so.
My daughter's had to mash it out.
Yeah, it gets dried up a little bit. It's hard to. Yeah, this is stuck in here. Getting it. Becomes like wax.
Does it?
Yeah, it's like kind of sticky. You know, I guess kind of like earwax even. It's just sticky.
Okay.
But I think it's just rather deeper, and so it fills up again, and that's the
Okay,
tough thing
yeah.
about it. I think though that you will probably want to spill more in there. In there, we're gonna get it a little bit more. Let's see if everything comes out without me having to do anything else beyond that. I might sometimes have to open it up. Let me do that. Hold on.
Yeah, looks like you might.
Just a little, so you shouldn't feel this, okay? Just a
Okay.
little blade, right? You okay?
I can feel it, but it's not painful.
Okay, yeah, you can feel me touching you. You
Yeah,
shouldn't feel
right.
anything sharp, good, because I can see it up there.
Oh, look at that. Oh, gross.
Mm-hmm.
Nice.
It's kind of cute,
Look at that.
isn't he?
Oh, look at that.
Yeah, that, wow.
There you
Nice.
go. And so it's like a dilated pore. That can heal
Yeah,
up,
that's
but
what
sometimes...
my doctor had
Tease that out. Are you okay? Oh my goodness, this little friend of yours. I think you're gonna lose a little weight today. It's like a rock. Wow. Look at that area there, huh? That is. That is a big blackhead. You might have the award for the biggest blackheads. Oh my goodness, no, this is under there actually. Look at that, it's under there. A little bit more, but not hurting you. It's like a rock under there. You're storing a little rock under your skin. It's like rock hard. Just make sure, again, I'm not hurting you. I'm gonna pull on it a little bit. I don't know if I can get this out in one piece. It certainly is satisfying when we do that.
You're okay. Yeah.
Am I doing too much to him? Is he okay? Here it comes. Oh, you're gonna actually, your clothes are gonna fit you better now. This thing is like a hump on your back.
Has it bothered you at all? Have you felt anything bad?
See that? It's coming out. It's just stuck on you. It's almost like it's like a raisin that gets really sort of like sticky and yeah, it's like a pore liner.
Your forehead has really healed up nicely.
Yeah, it has. Yeah, it's a good healer.
Healed up nicely.
I know you were kind of concerned about that one, huh? Being something, probably because your history, your who was it again?
Dr. Stiles mentioned it, that he said that might be a cancer under there. He said you better get that checked.
Probably because it kind of grew so fast and was quite big. It was just so unusual to be so big.
Yes.
Here we go. Here we go.
Yeah,
Here
my
it comes.
daughter, in fact, the one that was in, she had
Yeah, it's scary.
cancer one on her back.
Oh wow, that one came out nice too. They're like little rocks too. They're hitting her table right here, and they're like making a little rock sound, like when you hit something. Yeah, come there. Look at this. I'm gonna look at this angle. There's like a whole little empty space here too. But I think we got all that. I'm also gonna let this heal on its own because it will slowly get smaller. We've seen this before where they will heal in and get smaller. We can't sew it up because there's just it's like a scarred off sealed area right there.
I think he's relieved, aren't you?
Feels
You already get it?
No, I didn't want to. We're interrupting you. I'm sorry. We're all like ignoring you.
That's okay.
I can't listen to
It's
her.
like a little plug in a faucet. Remember old school plugs, like those black plugs
Yeah,
that you
yeah.
have in a faucet? Oh, look at that. You want to see it?
No.
not you,
Don't
not
show it to her. Don't show it to her.
really? Why?
Do you want to see it, Mom?
No.
No.
I told you.
Yeah. That's pretty wide. Come to this side. Come all the way over and see. Just gonna push against you. If only you could reach this. Huh? It was under there waiting to come out. I think there's more, in fact. Yeah, it's like a top of a cyst, I think. Let's get rid of that little piece right there. I'm gonna push against you a little bit. Doesn't feel bad. It actually kind of feels good, huh? That's what people say. A bit more. It's under there. There's still more in there. I think you have a cyst here. This is not really a blackhead anymore. You have a cyst that got trapped but had a bigger opening to the surface. So look, just looks like a big blackhead. And it keeps going. You're all right, huh? All right. Got it there. Okay, I'm gonna push from up here because there's something up here. I can feel it up there. Just trying to get anything out here. There we go. Let's see if I can squeeze. Wait a minute. Let's see if I can squeeze it here. Okay, pushing again. I think it's deceiving how small this is. I think it's bigger than it looks. You okay? Okay, good. I'm gonna have to show you all the stuff that comes out of here.
Yeah.
Yeah. It's just hard because I can't squeeze your back very easily here. I can't pinch onto it. But soon you'll be able to wear those backless dresses again. Let's get all this out. I'm getting a little workout today though. Look, it keeps coming. Keeps coming. Just I can't pinch. Let's see. Okay, I might have to resort to, I don't know, I might have to resort to punching this. We'll see here. Not hurting you, right?
No.
Good. Just need to make it a little nick in the skin a little wider so we can get all that out. Oh, we may never get to your other little baby ones. This one's gonna take all our time. I think we're getting to the end now. Okay, this has definitely been there longer than 8 months. Let me just tell you.
Yeah.
It has been there longer than 8 months, for sure. I need to convert that to a punch. Look, I can't get it all out there. Look, it's still coming. Look at that, here it comes. I think I've released a lot of it though. Show it all to you. My gosh, it keeps coming. Okay, come on, we must be getting to the bottom now. It's like it's, look, it's still coming. What the heck? Put my grr in there. Getting me a workout. What the heck? At least you can giggle about it. Oh my goodness, look, there he goes again. It's like, I'm gonna push this way now. It's like a deep tissue massage. Phew. Okay, come on now. Am I gonna get all this out easily, huh? Let me see, maybe I try my pickups now. Of course, that are probably too big for this. Try this way. Am I gonna get the rest of this out? Let me see, how am I gonna do it? Everybody that watches our channel knows that I talk to my blackheads, so sorry, I'm gonna talk to it because I'm trying to get it out. It is. It is. No one has tried to do that for you before, huh?
No.
Nobody. The first one. This one is. He's decided to. He thought he was gonna set up a shop here. I might need to convert this to a punch here, I think, huh? Because look, he's not wanting to come out all the way, and I want to get it all now. Okay. Take this instead, and now let's try to put remove a little bit more of the superficial skin so we can get to the whole cyst now. Now that we know it's a cyst in there, and my wrestling paper, get the top of that off. There we go. There's the whole cyst sac there. Because a cyst has a little wall around it, like a little balloon, and if you don't take the whole wall out, it will come back, and that's why you have to kind of be now we converted it, because now I know that it's a cyst and not just a blackhead. The other ones are blackheads for sure. There's no way they're like this. But if I don't take that whole thing out, it will just come right back, and you won't like that, because then you went to all that trouble. See this? Look, it's still under there. But it doesn't want to, it's like it doesn't want to leave you. Your back is is it was taking up space, making your back look white, look thicker, I think. Now we're gonna thin it down a little bit.
Okay.
I can't squeeze that out though. Try both hands again. See, it's right there. Okay, let me hold it here. This is where I need 3 hands. This is where those 3 hands would come into handy. You okay? Okay, good. Almost there. We have sometimes, actually all the time, pretty much, the sac, the wall of the sac is very thin and friable, so I have to be very gentle pulling it out, but I gotta try to get it all. Okay, now, I think I'm pretty good now, but make sure I'm not hurting you. I'm just gonna feel around. Wait a minute, there's still something under there. This. See, there's still a little something right there. Look, I see a wall there. It's like lighter than skin color right here. You see that too? Right there. You're like my sidekick, you know, like with Johnny Carson, with like the guy who talks next to him. Valerie, you're like my sidekick. They have to, like, I talk to you because I have to talk to somebody. You're like,
Like someone else is watching it.
Yeah, you know how they have like all the late night show guys usually have like sidekicks, like that you talk, because I think they use them to talk to and bounce things off us, so they're not just talking to nobody. You know, it helps with the conversation. You're like my conversation person. You're like, Come here, it's stuck. Look how adherent it is. Okay, it's coming, but not without a fight. I'm fighting it. You're okay, though? Okay. Look, it's right there. Okay, I've got it. I think I got it now. Let's just double check again. Anything under there that I can see? I don't see anything, but I'm just not totally convinced because it's... I wonder if they're looking for us. You don't think so? Okay, okay, good. Okay, feel better now, but it's still, there was like a space right over here that things could hide under. So there's a chance when you have cysts like...
Putting some pressure on you, okay?
Yeah.
We'll see how this works. Alright, well, we got part of it out here. Let's see about this other side. And you're doing okay, yeah?
Yeah.
If we can't get any more here. Still coming.
So I'll just see if I can, oh, I'm wearing the wrong size gloves here. See if I can give it a little squeeze here first.
It's deep. It's
Talk
deep.
about a big one.
Oh, he did that in Cincinnati, and we stood there
Did
forever, and it kept coming.
Oh, really?
Yeah, it'll come.
And then you asked her to marry you, right? That's when you that's when you proposed.
If you don't,
You said, I gotta marry her.
if you don't get that
Got
whole
that.
thing out, it'll come back again.
Yep, exactly. You know exactly what we're talking about. So actually, I should have told her to bring a curette too.
No, I never seen her there, but it took a year to get her naked.
Well, I guess.
Well, it should be that way.
I guess his moves
Goodness
weren't that
sakes.
great.
That's right. His moves weren't that good. That's why, you see? She's got a good comeback for you. No wonder you guys have been together for 50 years.
Oh, I have to do that. He's something else.
He's a piece of work, isn't he?
It hurts a little, but
It does?
not
Oh,
that
okay.
bad.
No,
Not that
I'm going to
bad.
give you a little more numbing right under there. You know
Okay.
the device here, it's like called a curette, and it can scoop some of the edges out. Because, yeah, it's like an open area underneath there. Am I hurting you now?
No.
Okay.
No, it's all right.
It's like compacted skin under there.
I'll
but
let you know.
yeah, and hopefully if we leave it open a little like this, it'll heal in or at least shrink down. But I do feel like it dives down a little bit right under there. Let me
So,
see if I can
do you
feel.
get what I call it a head?
Yeah, we got the top of it. Yeah, I'm gonna open this up. It's numb here, that's why I can do this, and he won't feel it. If your husband's wondering, because don't try this at home, okay, husband?
No. Oh, I
Yeah,
no,
because
I
you need
would
numb
keep-
in there to try this.
That I would have never squeezed that out ever.
Good
job.
Good job, yeah.
Nah, they don't go.
Not hurting you, right?
No, you're not hurting
See,
me.
it's underneath there. It's pretty deep.
Yeah, I
There's still
know that
something
because that
underneath
thing's been
here.
coming back for 20 years or more.
But we have thick skin on our back, so see, we're trying to get the whole thing. See, there's like almost like a little shell of it
Yeah.
here. A little remnants here. Because that's under there. It's like it dives down into a little, there's like a little tunnel right here. So I'm going to be carefully just try to see if I can get that out of there. See, it's stuck down there. Wow, that's a good like half a centimeter down under there.
That starts with a blackhead, right?
Yeah.
I thought so, yeah.
It
I don't
is
know,
there.
I've been prone
It's
to
like
blackheads
stuck
on my
under
back all my life. I don't
Yeah,
know
some
why.
people are.
And when I was young, a few on my face, but not all that much, you know.
So you know I have a whole channel about people that love to watch this stuff, and you're not alone. There's a lot of people that like
What is
this.
what is
So
it
you
on?
guys are gonna become the new stars. I'm serious. You guys are gonna become the new stars.
Is it on
You
cable
guys are.
or what?
It's on cable. No, it's on YouTube.
Oh, on YouTube.
YouTube, yeah. Do you ever go on YouTube and watch a little bit,
No,
or maybe
I
your
don't, but
grandkids
my-
or your
my
kids?
grandkids can pull it up,
Oh,
yeah.
they might see you then, because I think it's very pop. How old are your grandkids?
26 and
Oh, they might be
17.
of the age that they have heard of this. They probably already heard of
Is
it.
there a certain site that we
Yeah, if you Google if you go on my name, if you actually go on my name, you'll find it.
Oh, okay.
Just put my Dr. Sandra Lee. You know, not my
Okay.
husband's name. But it's
I'll wait a
technically.
while though, because this is just being done.
Yes.
Then I'll have them look
This is
and
going to
see.
take a little while for us to get it actually out on video.
Of course, of course.
But I think we got it now. Let's see how well that, I think it's going to heal better. It might still want to form something, but at least I open it up so it can heal a little slowly from the inside out.
Yeah.
Okay, and I think I got all of it. It's like there's a general hole here, and then there's one small deeper hole that I reach into, and I think I pulled all that out. Just trying to make sure I get it all. Let me do a little scrape of that.
Go ahead. I can't feel it at all. I mean, I can feel that you're scraping.
But
I
you
know
can't
that.
feel pain. Yeah,
But
that's
it's
the
not
most important.
painful,
Yeah, if
yeah.
I scratch a little bit, it might abrade it
Right.
enough that it'll seal up.
Right.
And we have you on that antibiotic anyways because you have that one that's a little inflamed. Yeah. Oh look, I am getting some stuff coming out.
Oh, I know it's
Like a
deep.
cyst
It's
wall.
been coming
Oh,
back
yeah.
for years and years.
Yeah, I don't know how because you would have gotten rid of these sooner if you yourself could have scraped them, but you can't.
Yeah, I can't see them actually.
Yeah.
They don't hurt or nothing. And well, I don't really look at my back in the mirror, but I should.
Well, you're much cuter coming, you see, so that's why. That's more important. So there's a smaller one here that I'm taking away from your husband. I'm sorry.
That's good.
Sorry about that.
Take
Then I'm
them all
taking this one away from him.
because
That's the kind he likes right there.
It hurts when he does.
Make sure that pore is exposed. It looks like it is pretty much though. There's one under there just waiting to come out. One of these days, I'm gonna let Christy do it for me. I know she wants to. See if it will even come out. See, I think I might need to punch it because they're so stuck in there.
Mm-hmm.
You've been storing this one in there for a while.
I tried to keep it a secret.
You did, huh? There we go. I think it's nice because we got the little sack there. See, right under there. It was under there. There we go. We'll do this first and see. Otherwise, we'll do a little punch. Get it all out whole, maybe. See, there's a sack there, the white part here. Let's see it. Yeah, we can pull it out like that. Sometimes they're still a little friable. Maybe we'll use that. Here, let me try to push it one more time first and see. It keeps coming. You okay?
Me?
Yeah?
Oh,
You're joyful.
a good way to lose weight.
Keeps coming.
I feel better already.
You do, huh? I like that. It's been there for a while and it's very like clean. It's very like untouched.
Well, it's in a place that it's awkward.
The hardest place for you to reach, huh? Yeah, I think if we, let's take a little bit that way. There's no way, so I need to take a little punch. See if that will help us to get it all out. Push it first here because it's under there. There's a little sac under the skin and we gotta try to get all of it. And another piece of gauze. There's a little sac under the skin and we gotta try to get all of it. And another piece of gauze. Thank you. It's like a hidden one under there. Thank you. Sorry, take it. I can feel on the outside, it's still there. On the outside, it's still there. We're getting there. What should I do to get the rest of this out, huh, girls? No, I mean, there's just still a little bit more underneath there, even though there's a little. So what were you thinking was back here? You could just feel a bump, but you didn't really know exactly what it was?
No, I didn't even know I had it.
Oh,
I
you-
came
oh,
in
you
for
didn't?
the
I'm gonna push on you.
skin cancer, as I said, and then a body scan.
Uh-huh.
And when he did the body scan, that's when he saw the large blackhead.
Got it. I might need a pickup for this. This is called a pore. Am I pushing too hard on you?
No.
Okay. Because it's kind of, it's an awkward area because it's your ear and it's flexible there. You know, there being cartilage there, so it's actually kind of hard for me to, right, here we go, to kind of pull it out without using a tweezer or forceps. Oh, I think I can get it with this though. How's the lighting on there? Okay, not too many shadows. Look at that one. I gotta show this to you. You were storing something in here. You could smuggle diamonds or something across the border. There's most of it. There's a little bit of skin right here. Let me just see if I can pull that. Looks like that's just part of your ear here. Let me just make sure. Just a little bit of fibrous tissue right here. Good. Nice and flat, and that will heal just fine right in the back after you drop it from. So these don't bother you at all. Did you feel a bump here though, I'm sure. But you just don't. Doesn't really do anything matter to you. But it's nice to get them off. That's very satisfying right there. You have a little one here. Maybe I can take it off without making a nick. Yep, got rid of that. Okay, let me go to there. And let's get the milia first. I mean the whitehead. Whitehead first. And blackheads. The difference between them is a whitehead is like a closed comedone, and the blackheads are open comedones, meaning they're exposed to air and they turn dark because they're oxidized by oxygen. Not done popping? Check out this next video or check out my all access membership page to watch more videos.